Thank you so much for coming. We're excited.
I can hear you now.
All right, perfect. Thank you so much. We're so excited to have you. I'm going to let Isaiah start off with his introductions.
I'm excited about the opportunity to be here. Man, anytime I get the evening with Dr. Carolyn Deborah Furholden of Michigan State University, I don't know if you all want me to say all full names, right? That's how we rolling.
You know what? At this point, we're family.
Hey,
you already put my government name out there, so
I just want to make sure I know what part. I want to know what party I'm in right now. That's all. So, Dr. Jennifer Edwards or Marie Joy Edwards Johnson, and obviously we have an amazing guest with us today, Dr. Kizzmekia Corbett. Oh yeah, so we're all family now, and I hope you know this. Like you're right down the road from my family. I got family in Madison, so if you just take Hurdle Mills right on across, about an hour in North Carolina, right in your hometown. So we are about to have a family conversation tonight. So I'm excited about the opportunity to be here.
I love that.
It's
been a long day, so
this was your first day. Congratulations. We'll
absolutely.
Get into your bio, but congratulations. Yeah.
Thank you.
We can vouch for Isaiah. He's not a stalker. He just likes to do his homework. Let's just
he likes putting people's whole government name out there too.
I like hanging out with good people. That's all.
I know he had to dig deep for Hurdle Mills because that was I was 5 years old when I lived there.
No, actually, you know what? It popped up real quick. I mean, it was easy to find. You're easy to read. When the Harvard thing pops, it's easy to find out whatever information you want.
Oh, Lord.
Isaiah, take us away.
No, I'm excited about the opportunity to be here. My name is Isaiah Oliver. I serve as president and CEO at the Community Foundation of Greater Flint. And people often say, what does that mean? Well, for me, that means I lead an organization focused on engaging people in the world of philanthropy, giving time and talent and treasure. Cream. You know it, cash rules everything around me. Cream, get the money, dollar bill. No. So, I mean, honestly, really focusing on the trifecta and really engaging people and making sure they give what they need to make the community they love a better place to live in and work in and contribute to. And what we've learned at the Community Foundation after years of giving away dollars is there's a whole lot more levers that we need to be pulling on to make community whole, to make community better. And we've been engaging around multi-sector partnerships that lead to multi-sector solutions lately. And the work of vaccines, vaccine hesitancy, vaccine access, and really engaging our health community has allowed us to explore a world that we didn't know existed. What does it mean to make sure people have what they need, the information that they need to make the decisions that are in the best interest of them and their families? And as a result, we've been on this journey to explore our community, to explore ourselves, to learn what's needed, to figure out what gaps we feel. And we've been on a journey that has included maybe 10, 15 podcasts, really focused on making sure people get to ask their questions, get those questions answered, turning to community, amplifying the voices of residents in the conversations. And so this is another opportunity to do that. So again, I've been with Dr. EJ, Dr. Verholden, and now Dr. Kizzmekia Corbett to really have a homegrown, hometown conversation about all of the questions that you might have. And so there are a number of folks that I'm sure that are watching us right now, the questions that you all might have about this vaccine. And so that said, I'm going to throw over to Dr. EJ to give us a round of introductions, I guess the deeper, more professional introductions, and then I'm going to ask some sincerely ignorant questions to get us started.
All right, I'm going to let Dr. Verholden go, and then I'll talk a little bit about myself and introduce our very special guests.
All right, great. So hi, Dr. Corbett. I'm so excited to have you with us today. I'm Dr. Deborah Verholden. I'm an epidemiologist by training. I hang out with these wonderful people, including my honorary little brother, because he has very much little brother vibes, but he's a good brother. He's a good brother. I serve on our Flint Coronavirus Task Force, as well as the Michigan Coronavirus Task Force and the New York City Task Force. I've devoted my whole life to health equity and racial equity. From the time I was a kid, I realized we lived in a world that didn't work fairly for everyone. So my life's work is about getting that straight. I'm going to toss it over to my good friend and colleague. I'm at the MSU campus in Flint. We are small and mighty at the same time. And Dr. EJ is our community dean. And it's just really an honor to be here tonight. I'm excited for our people to hear right from you about this vaccine and some other things related to COVID.
I will second everything my friends and colleagues have said. I'm Jennifer Edwards Johnson. I'm a family physician, public health trained family physician and community assistant dean of our Flint campus of the College of Human Medicine. And I too am sort of dedicated to health equity and really dedicated to training students from underrepresented backgrounds to do this work. I am honored to introduce our special guest today. And I have to say, when I reached out to her, the enthusiasm and grace with which she said yes was just amazing. So, she was excited, and I'm excited to introduce her. More formally, Dr. Kizzmekia Corbett served as a research fellow and the scientific lead for the coronavirus vaccines and immunopathogenesis team at the National Institutes of Health. She received her BS from in biological sciences with a secondary major in sociology in 2008 from the University of Maryland, Baltimore County, where she was a Meyerhoff Scholar and an NIH undergraduate scholar. She then attended University of North Carolina at Chapel Hill, where she obtained her PhD in microbiology and immunology in 2014. In all, she has spent 15 years studying dengue virus, respiratory syncytial virus, influenza virus, and coronaviruses. Dr. Corbett is an active member of the NIH Fellows Committee and an avid advocator of STEM education and vaccine awareness globally and in the African American community. Just today, like we said, Dr. Corbett started as the lead in the Harvard T.H. Chan School of Public Health's new coronaviruses and other relevant emerging infectious diseases lab. And we are so excited to have her here today. Thank you, Dr. Corbett.
Thank you so much. Can you hear me?
We can hear you.
Okay. Yeah, thank you so much. I don't remember my reply, but you know what? These types of events, anchoring my day with the community, is what I set out to do when I started doing science in the beginning. I said that I wanted to make sure that my science translated well to people so that people understood it. It's fortunate enough that I was able to lead development of a coronavirus vaccine. And in such dire times, particularly in communities like communities around Flint, my voice is so important. And so I get to do this, and it's exciting to me. And yes, today I did start at Chan, so I'm a little bit loopy because I've been doing all kinds of things. It's a lot to get your lab up and running, but it is a blessing to be here, and I am extremely happy to have this conversation.
Thank you so much. So why don't we start, would you mind telling us a little bit about some of the things you're working on now? And then secondarily, what is it that you think it's really important our Flint community walks away understanding about coronaviruses and the COVID vaccine?
So we're working on all kinds of things now. There's about, so I'm talking about at the National Institutes of Health because I just left on Friday. Yeah. But nevertheless, I'm actually still a special volunteer at the NIH because it was important to me that we finish off the work that we started. And my lab is actually being built at Chan. Nevertheless, so we are working on determining whether or not people are going to need to get boosted, what they would need to get boosted with. I know that many people probably hear about variants on the news. And so we assess the ability of the vaccines to protect people from variants. And we actually look at second and third generation vaccine candidates. So, we started with mRNA 1273, but we had a lot of tools in our toolbox. And so we are looking at second and third generation vaccine candidates that might be, more broad or better for people with people that are on immunosuppressants or immune compromised individuals and things like that. So there's a ton of work that still needs to be done. And so that's what we're doing.
Fantastic. Sounds like you had a lot to, the first vaccine came out and like you said, everyone kind of started getting, thinking about what that vaccine would look like. And very quickly after that, we started hearing the conversation turn to variants and would we need boosters? And so it's exciting to hear that the next level, the next work really includes examining, okay, who needs boosters? When will we need them? That sort of thing.
Yes, that is exactly what we're doing. And it is definitely a decision that is something that, a lot of people have the view that if you're in the US, then you just hold steady, right? And then we get vaccines out around the globe. So really what we're just deciding is, do we keep the doses that we bought or do we send them around the globe? So do we stockpile vaccine here for people in the United States if we need a booster in fall or, next year or whenever? So that is a very difficult decision to make, and we're going to make it in a very scientifically astute way. And so I think we have about 6 different types of experiments that are going on in people and also in animal models to determine that.
I'm really excited to hear you say this idea about we're going to make decisions in a really scientifically astute way. Because a lot of questions about whether we get the vaccine kind of hinge on, well, how do we know? Who makes this decision? How do we come to those guidelines? Can you talk a little bit?
The guidelines come from data points only. And it is, so even down to the fact that I use this example because it's one that most people are familiar with. The CDC saying you're not fully vaccinated until you are at 2 weeks after your second dose. That is, if you've gotten the Moderna or the Pfizer vaccine. That actually comes from data. That is the peak of one's immune response. That is when the case count started in the, well, it didn't start then, but that's when they started to get like the 95% efficacy in the phase 3 clinical trial. So that is the point where we know people are 94, 95 less able to get COVID-19. And so that is when we consider people to be fully vaccinated. So all of these, every single recommendation that's going to come from the CDC or the FDA is going to be extremely data intense. Trust me. Everyone is dotting T's and crossing I's.
So here's a big question that's come up in this community a lot, right? And I had a little bit of critique about calling this thing Operation Warp Speed, because I think what happened is what a lot of people heard was quick and dirty or corner cutting or something like that. And we've done our best to explain to people, this mRNA vaccine technology is not brand new. We didn't just create the technology in response to COVID, but great scientists like you who were already in the game were able to then move that technology to bear. Can you tell us a little bit about that and maybe give people some reassurance that no steps were skipped and this isn't something that just got pulled out of a hat?
Yeah, no, sure. So, I mean, I guess I didn't come up with the name Operation Warp Speed, but I should apologize to the people about, that name, because, I think that one of the things that even with my first tweet about the vaccine, I'm like, yay, we like in record speed. It's brag worthy for us because, I mean, it is a feat to have a vaccine that is so safe and so effective, come to number one, clinical trials as quickly, and of course, to get authorized as quickly. And it is an absolute historic moment. But we should have thought about the people a little bit more in the way that we approach that. Mostly what we should have done is been very much like in people's face with all of the science that went into the vaccine, even prior to the pandemic starting. So mRNA technology is actually not news. These mRNA technology in the case of, for example, cancer therapeutics have been in clinical trials before. Moderna is certainly not a new company, neither is BioNTech, for which Pfizer is partnering with. And mRNA vaccines have been in people. So Zika mRNA vaccines have been in trial, et cetera. So actually the FDA considers mRNA platform to be reliable in its manufacturability, which is actually a check mark when you think about something that you want to develop in the case of a pandemic when there's a dire need to get a vaccine out. And then the science that went into the vaccine under my leadership when I was at the National Institutes of Health happened over the course of 6 years. And before I even got there, they were studying coronavirus vaccines in the context of other coronaviruses. And, all of the experiments that went into the preclinical phase, the phase 1 clinical trial, phase 2 clinical trials, and then lastly, the phase 3 clinical trials, nothing was skipped. It's not like the FDA said, oh, you can skip this step because like you're Kizzmekia Corbett or because it's a pandemic. Actually, what was said was we're about to put every single brain that we have on this so that the data, when it comes out, again, it has several different checkpoints and there are so many eyes that are checking it. And also we can say, not just all the brains on this, but also resources, right? Part of the problem with slow development of vaccines or therapies is the fact that it's billions of dollars that is being spent. And so to beg of companies to do that, sometimes is just not how it works. They take their time. But in this case, the government said, okay, here are the resources. We just want to make sure that there is a safe and effective vaccine and that it is vetted properly.
I love it. So no steps were skipped. The technology was all ready to bear. I want to ask you one quick
all the time. The only thing that was skipped was my sleep.
Right.
So like we did not sleep for a year and a half. I feel like I'm literally just now catching up to sleep. No, I
got it.
Understood.
So you said something that I want to pick up on, and then we got some questions coming up in the chat. And our good brother Isaiah is going to jump in here too. You said you all were already studying coronaviruses.
Right.
Could you say just a little bit more about that? Because it's my understanding the common cold is in that family. Coronavirus is not new to our population. Yeah. It's not new, but this particular coronavirus is SARS-CoV-2. Could you just say a little bit more about that?
You can think about it like your family, for example, right? There's brothers and sisters, there's cousins, there's aunts and uncles. Viruses have the same thing going on. They have a family tree in the same way. So in a family tree for coronaviruses, if that's the last name of the family, in that family tree, there are 7 different types of coronaviruses that can affect humans. Actually, 4 of them cause the common cold. And so about, depending on the study, but about 20 to 30% of the common cold is actually caused by more mild coronaviruses every single year. And so, right, coronaviruses are not news. And aside from that, there have been 2 coronavirus outbreaks that have caused really extremely detrimental mortality. The MERS outbreak in around 2013 and 2014, and then the SARS outbreak a little over a decade ago. And so because of that history, we understood that coronaviruses have the potential to cause this type of pandemic. And so we prepared for it. The entire field of study is called pandemic preparedness. It is where you can pinpoint a viral family that has that type of potential, and then you study that viral family so that you can take that knowledge that you gain from its cousins, so to speak. And if there's a pandemic, you can just transplant that knowledge and really move very quickly to make sure that we have a vaccine.
That's awesome.
That is awesome.
All right, you ready for me to jump in here?
Come on, cousin.
I will. All right, we're about to jump in here. We got several questions already in the chat. I'm going to work the chat and kind of throw in Dr. EJ and Dr. Verhoeven in between. But we've got Shardy Shard Wagner. His question is, I understand that there are several variants to the coronavirus that has been developed since we've all learned of its recent conception. I would like to know, in terms of research on this pestilence, what advances have scientists and members of the medical community discovered about this virus and the long-term effects it will have for years to come?
I can take that question 2 different ways. So I'll take it the first way, which is if you think about long-term effects by way of, like, if someone gets infected with coronavirus, what kind of long-term effects could they have? Oh my God, heart problems, respiratory problems, people are having to have lung transplants. People are losing their taste and smell indefinitely. Yeah, those kinds of things are happening to people who have gotten coronavirus. So there are certainly a subset of people who have what are called long COVID. I think the other way that you could maybe take that question is that, so what kind of long-term effects would the variants have? Meaning, would this virus stay around long-term in the community or in the world? And I think Dr. Fauci kind of put it most eloquently in that we probably aren't in a position to eradicate COVID-19. We're only in a position to control it at that point. Unfortunately, humans being humans, we allow this virus to just basically embed itself in every single corner of the globe. And so herd immunity will get it to a point where we have controlled it and things are normal and it's like, okay, but will we eradicate it anytime soon? It would be very difficult. We would have to, get vaccines out to everyone in the world in some haste. And that is just not possible. We don't have that type of supply. And so I think you can expect the virus in general around the world to be around for some time.
So that's interesting. It brings us right to Linda Poley's question. I'm going to take her question in sections instead of asking all 3. I'm going to start with the first one, which is, what is the strategy for continued testing of the population?
If you present yourself with COVID-19 symptoms, whether you're vaccinated or not, then you should go get a COVID-19 test. The COVID-19 test will probably be incorporated into your standard panel of, like, if you go to the doctor, you say, oh my God, I have a cold, my throat's sore. They give you like a full panel, like flu, RSV, and some other coronaviruses. It probably will be incorporated into that as well. So testing will remain the same. The recommendations around testing have not changed. If you're sick, go get tested.
And how long are we imagining this program will continue?
Indefinitely. Well, for the foreseeable future. We will. We do not want people to assume that they do not have COVID-19 if they have the sniffles or any other presentation of respiratory disease.
So we've been having lots of conversation about the vaccine, and I will tell you, as a community, we've kind of moved past this conversation of testing. Do we need to be making testing more available in more places than we are right now, or are we getting it right, not just locally but across the country?
I think So at least from what I can tell, at least where I've lived, testing is still available at the same places at which it was available before. It's just less need for it because people are more vaccinated than they were before. So you can still go to your CVS or your Walgreens or community centers, community health centers, and get tested for COVID-19. Actually, I just moved to Boston, and there was a huge testing and vaccine site right across in Franklin Park.
So before your move to Boston, which was today-ish, you were doing church speeches at churches and community centers and really starting to build trust. And we've noticed that you spend a lot of time on Twitter. Why did you decide Twitter was the way, social media was the way to get information out?
I mean, I like to talk. And I don't know if you can tell by my Twitter, but I also like to talk crap. So it works for me.
I know a guy.
We all know a guy.
As long as we all know this guy and we think he's cool, I think this works out. But so you kind of leaned into Twitter. And so you leaned into Twitter. You've leaned into doing these speeches at churches and community centers. Talk a little bit about what it means to build trust. Am I echoing for everyone or just me?
Just a little bit.
Okay. Not really sure what I'm doing. Wrong.
So I should say that I did lean into it, but I think only publicly was it like noticeable. But this is kind of like my zhuzh. Like I've taught sex education at my local health department. I'm actually going to miss my health department. I don't live there anymore, but I've done stuff for Girl Scouts. I've always been like a health liaison with my own personal church, and so to like branch out and do other churches was kind of it was easy. It was an easy transition for me. It just became very necessary for me. I actually was willing to take a leave of absence with no pay to make sure that Black people got vaccinated, because I did not want to get to the fall being a Black inventor of a vaccine that was saving people's lives at 95%, and then my communities were devastated in the fall because we weren't vaccinated and no one was talking to us. And so I said, I'm going to go talk to them. And so that's what I did. Just about every other night I was on, and actually that's not stopping. So I'm booked until mid 2022, by the way. So it's just because I'm gone from the NIH, my public service capacity is not changing. That's actually why of the job offers that I chose, that I opted for, Harvard T.H. Chan School of Public Health, because they really have a strong network, and they also have an infrastructure to really be able to support me every night on a webinar, right? So it won't stop. I'm still out here. I'm still in these streets. I want to see every single person who can be vaccinated. And I almost wanted to get on a tour bus and do it. So if we can't do that, we'll do it virtually.
I want to say your advocacy didn't just start with the vaccine, right? You have been someone who's been a champion for students of color getting in science and STEM fields for a while. You're a Meyerhoff scholar. You're sort of from that tradition. Can you talk a little bit about that?
My advocacy, I mean, not just with around health. I'm like, I have every single male cousin that I have on my mom's side has been to prison. So I am a strong, justice advocate as well. I mean, health disparities has been a passion of mine, particularly since I was in undergrad and I conducted research with a sociology professor in health disparities. So yeah, I've always kind of been a community advocate, and my partner is like an anti-race guru, and so I don't really have choices. As for me in my house, but yeah, so it's just what we do. It's just what we do. I have to, it's rare that, especially knowing from where I come, that people look like me and talk like me and are able to really translate the science in that way. And we would just be left out. I mean, honestly, today I'm revising a manuscript with my team back at the NIH, and there was a comment, why are we using beta and gamma? Why don't we use the old names? It's a scientific journal. Well, the point is that we want to start showing people that we are taking what they're hearing on the media and using it in scientific journals, so that one day when a little Black girl decides she wants to wake up and go to PubMed.com, she sees beta and it translates well to her and not B1351 or whatever. And so there are not people who understand that, because there are people who just have never, ever been able to experience being marginalized and left out. And so it is my job to do it.
Yeah, speaking of young girls and boys, Jerry Jean has a question about children. She says, should we have any concerns about getting children 12 and up vaccinated, being there has recently been a concern with some issues with swelling around the heart?
Well, I can't make anyone's choice for them, but as for me and my house, and my nieces and nephews and my godkids, they are certainly vaccinated, because again, similar to the J&J vaccine, while there is indication that there might be an adverse effect, number one, it's not deadly. And then number two, it is something that is temporary and also happens at such a low rate that when you balance out the risk assessment, vaccinating your kids versus not vaccinating your kids, if both of these groups were to become in contact with COVID-19, despite all things, the kids that are unvaccinated have a higher chance of getting severely ill, more ill than what the temporary heart complications entail.
Yeah, the second half of this question says, also, can you speak around the reproductive concerns after being vaccinated?
I can speak about them, except that there aren't any for me, because the data doesn't show any reproductive concerns. So the reproductive concerns that float around the internet are simply just not fact, not true at all. Actually, that is actually my worst rumor. So I joke with my partner that, like, when we actually move into our new house, we're in a temporary apartment now, but when we move into our new house, I'm like, I actually want to host a dinner party with like all the people that I know who started lies on the internet, and just be like, come over, let's have champagne, let's talk about it. Like, why would you do that? I saw the numbers of Black women just topple down from getting vaccinated when those rumors came out. Actually, it was the first time I've ever seen a graph comparing Black women and Black men, where Black men were actually beating us at doing something right for their health. And it was because this internet rumor around reproductive concerns. If the FDA would shut down a vaccine temporarily to assess whether or not there are, blood clots with the J&J vaccine, do you know what they would do if people were turning up to have reproductive issues? Actually, there's multiple studies now too that just show that there's no reproductive concerns. It doesn't benefit you to get the vaccine. Like, it's not going to increase your fertility, but it's also not going to do anything detrimental to your fertility. You will be the same person with the same fertility when you get vaccinated.
So you've been doing a lot of work talking to folks, and I think most will say, man, let's get her on so we can ask some questions about the science. I'd like to ask a question about all of these conversations you've had. What worries people the most as they're talking to you about COVID-19? Like, what questions are they coming to you with?
The speed of the development. I get a lot of that. I get a lot of whatever is the flavor on Instagram of the day. It's just, gosh. It's actually very sad. I mean, like, there's just going to have to be a movement towards science communication in a way that we just do better with social media. Yeah, that's generally what types of questions I get. I get just a lot of like, how can we trust you? Like, you little Black girl from the government, right? Hopefully that'll change as I start to build out my lab at Harvard. But also, yeah, so I used to get a lot of that too.
And I'm certain that Twitter is kind of building that trust, but what other things are you doing to build trust in the Black community or communities of color?
Just being who I am. I'm gonna tell it how it is, whether or not, like, Dr. Fauci's on the call with me, the president, it's just, I'm just who I am, and my data speaks for itself. And so I'm lucky enough that I can walk in the room and be Kizzmekia.
That's amazing. I see Deborah kind of leaning, Dr. Deborah kind of leaning in here. It seems like she either wants to support you in that, offer affirmation here, or she wants to ask a question. I'm not sure which.
I want to jump up and down and just tell you how much I love you. And not in any way condescending or anything, but just how tremendously proud I am of you. You know, as a former little Black girl who was interested in a career in science and found my way in public health, to see us represented across, we've got a family medicine physician, an epidemiologist, like the developer of mRNA 1273, like everything is possible. The thing that I find really moving about you is you have made it a point to keep giving back. And I would love to share something that to me, it's like, I saw this and I was like, she just keeps it 100. Like, I just love this woman so much. The duty to mentor, be visible, and represent. Can you say a little bit about that?
Yeah. So first of all, I'm once I got to the point where journal editors from, the top journals in the world, New England Journal of Medicine, calls up and says, "What data do you have? Science, Nature." I said, okay, what I will do is I will publish my data. But when someone asks me about a commentary, my commentaries will not be vaccine related or science related at all. All of my commentaries for the rest of my life will be social justice, period. So if you call me and you have a journal and you say, "Can you write something for my journal?" I'm going to say, "Sure, let's talk about Black people."
Yeah,
that is so fantastic.
Because
that is the dream, right? Like,
it's
that's fantastic.
We just have never been represented in that type of way, in those types of journals. And so I have a lot to say. And so why not use that platform to do that? And so that particular commentary was me reflecting on how I got to where I was, where when I walked into a lab for the first time, the first person that I saw was a Black man. And he was a PhD student in the lab that I worked in when I was 16 years old. But it was like, it felt like home in that way. And I think that like his presence in the lab and him taking me as his mentor really helped me to see that being a scientist was possible for me. And so what my duty is right now is to mentor and represent in that same kind of way. And so I make it a point to say that, I generally try to take a student or two that, nobody who has a Harvard lab probably would generally take. Their lesser experience. They take a lot of time to train, et cetera. But I think that we've arrived to that moment where it is that I might write one less paper a year because I took a student like that. Frankly, it does slow you down, but it's worth it in the end because that person could be me in 20 years. And then I could retire because there's no need for me anymore.
So somebody made a comment about, just being who you are. It's an interesting comment. Doesn't qualify as an answer when there are still people who are unfamiliar with your journey. Because what people may not realize is they didn't just let you up in NIH and say, "Hey, you got some experience or some credentials." Tell us a little bit really about your journey. I don't know if people realize that we are standing in the presence of greatness. You are a living legend. You are going down in the books, and especially because you're bringing so many along. Just tell us about your journey.
Yeah, that is right. And that is actually why I get a lot of like magazines saying, "Can we write this profile? We want to write a profile about you." And in the beginning, I was like, I know people are tired of seeing the profiles, right? Like Essence magazine, like, "Oh, Black scientist, this is her journey." But like, I made sure that those things were out there so that when people Google me, there is a credible magazine article from a place where they trust that has done their due diligence in researching who I am. So, Essence and like Washington Post, BET, and et cetera, et cetera, et cetera. So, I started doing research when I was 16 years old. My mom was educator. She was very keen or adamant about me getting a summer job, but moreover that it was from a scholastic slant. And so I joined the lab when I was 16 years old. I fell in love with research at that point, and I did every single thing in my entire career to make sure that I got to the point where I'm, in Boston, and I just started at Harvard today. That was like my entire goal, was to start my own lab one day and to be the lab, right? Be the lab boss. And so I went to University of Maryland, Baltimore County, and did like the Meyerhoff Scholarship. Throughout that time, I actually did internships every single summer at the National Institutes of Health. And the National Institutes of Health is a really unique place, particularly where I worked at the Vaccine Research Center, because you can really take a product into development from a government standpoint. So you're still doing public service and not at a company, but you're seeing the entire progression of a product. And so, I didn't just pop up on the scene. I got that so much in the beginning. It actually made me so mad, because I was like, all the people who are independent thinkers and do their own research, but y'all didn't look at the patents from like 5 years ago where my name was like plopped on it. Like, they're like, oh, they just got her to represent the government and she's Black. Like, no, but first of all, nobody can tell me to do anything. I'm not sure if that's clear yet, but no, you can't force me to do anything. I have done my job because I absolutely love my job. I love the science of it all. I love the ability to reach the public in this way. And I also I love the ability to be able to bring up a generation of scientists in a way that is like, okay, now all of these people can see themselves in me and hopefully be better than me. I mean, I love that.
So you didn't just get here yesterday.
No, I did not.
I read on your Wikipedia page, and I know how that goes, right?
First of all, that means I'm not the only person that was reading Wikipedia. Let's put that out there.
I've been fangirling Dr. Corbett for a long time. You did it so that you could put her middle name out in these streets. I've been fangirling.
You had nefarious intent.
Yes, exactly. But they said you have more than 15 years of experience. Mm-hmm. And, they say Black don't crack. I'm not going to throw your age out there, even though I know it. But I just want to underscore and make sure that people know how that came to be. Is you started at 16. Mm-hmm. You started with summer internships. Raise your hand on this live if you did a summer internship when you were in high school. Like, people just don't, like, they deflate the importance of these early exposure.
It is absolutely. I mean, like that. My retirement. My retirement goal is to basically have like a STEM academy in every single state that basically just like takes the top however many students and just at 13, and from 13 to 18 you are basically a scientist, like in real life, or an engineer or a mathematician, because it is like absolutely so important that that people have that early ability to be able to learn how to think very critically, to be able to ask questions in a very methodical way. The scientific process is something that you can't learn overnight. So the early we start, but beyond learning how to think like that, because sometimes that can even come innate, like, right? But deciding whether or not you love it. So I think we really lose a lot of talent, especially in the Black community, to be frank. Really, 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 really smart and curious children, they don't know where to take that. Like, I'm very curious, like, how does this work? Like, my little brother just is going to North Carolina A&T. He's going to be an engineer, but like his entire life, he's been taking stuff apart, rebuilding it in a completely different way. Like, and that type of curiosity would not necessarily bode well in a lot of schools. And so I want to be able to build like a place where kids can just be that. I guess I was lucky enough to be able to do that. But yes, we have to start early.
Can I make a request, Dr. Corbett? Hey. I have a request. Since you got the ear of the NIH, the mechanism that we need is an RU65.
Okay. Let me tell you something. I was on the NIH intramural programs.
Sure.
RAM. And so now I will be actually applying for extramural funding, which I think is just no comment since my patent royalties are going there, but nevertheless. Like they should be throwing me money, right? Like
yeah.
Right. So yeah, I will keep that in mind.
The RU65 is for senior investigators who, like you, because it's tough, right? Because we still need you in the lab. We need you leading the lab. We need you doing the good science and the innovation. And God bless you for all the pipeline work. But there are a lot of senior scientists who, if they had the opportunity, would be real champions in that work. So I love the title, the RU65. It would be for older, more seasoned professionals who are no longer trying to compete for their own grants, but really holding up the mantle to make sure that people like you don't have to do it all. And I love the name RU65 because
I love that. Please, you can email Dr. Collins yourself. He's actually very great. So Dr. Collins is my second favorite person at NIH. My first is Dr. Barney Graham, my immediate boss, but the director of the National Institute of Health. Number one, because anytime we get on a call, we just talk about Jesus for like 30 minutes. It's like he's Christian and he's a scientist and he keeps it real and the break out in prayer. Like I love that, So you should email him yourself. I'm pretty sure that he might reply.
Yeah. RU65 sounds amazing for all of you medical folks, right? You scientists. But I'll tell you, what I'm most excited about is you being on 24/7, 365. And that and your commitment to the work, your commitment to the grind is really important. But I think what we've learned in this pandemic is that, or I just say a double down in this pandemic, is that the mother, what is it? Invention is the mother of innovation or some craziness. What is it? What is the quote, Deborah?
If you don't know, we don't know.
You know what? The mother of invention.
That part, right? And so,
mother of invention.
Say it again. That's what you do for me, right, Deborah? You kind of make stuff make sense.
Yeah, I speak Isaiah.
No, but so that to that point though, the point that Deborah just made. How do we take advantage of the moment that we just had, right? We just had political polarization. We had a global pandemic, and folks are trying to figure it out, and we're trying to pipeline young people into the spaces where they can be thoughtful and be innovative and kind of think outside of the box. What is this moment offering us that we might miss if we just don't take the moment and absorb it?
I mean, my answer is one. I've been saying this the whole time. I actually was like, okay, basically this pandemic has come here. Basically what the virus did was take advantage of every single social infrastructure that humans have failed at. So Black people were dying at a 2 to 3 times X rate because we have failed at keeping Black people healthy. Overpopulated cities went down and under the pandemic at first because why are people living on top of each other in New York City? Et cetera, all types of things, right? I felt like it was a moment. My niece was like, people kept asking me like, oh, when are the kids going back to school? And I'm like, for what? Like, what are they learning? Like, exactly. Honestly, like my niece actually, for the first time, she's like, I got an A in math. And I was like, do you know why you got an A now? And she's like, because I had time to think about it. So I think it taught teachers how to teach in a different way. It gave students a little bit of independence. I felt like the pandemic actually came as the virus's way of saying, get your house in order, as I say in church, right? Get your house in order. And with that being said, I thought that it was a moment for us to dismantle some really critical things. And so Dr. Collins, who I was just speaking of very fondly, he actually took it as a moment to say, okay, look, this Black woman is leaving the NIH. She's invented the vaccine. We just had George Floyd. He took all those things into account and said, I'm going to dismantle structural racism at the National Institutes of Health. I'm going to create an entire initiative around that called the Unite Initiative. And so I think that if we did that in every single sector, that's what I think that the pandemic is washing out in so many ways.
Thank you. I don't have a whole lot of questions in the chat, so I'm going to encourage folks to kind of jump in here and ask some questions. We have an amazing talent in the room, in the Zoom.
I guess people don't probably watch the news or whatever, but like Novavax's vaccine results are like amazing. I can't wait to get off and read the paper, but I mean, we'll read the rest of the press release. But yeah, nobody's asking about Novavax. That might be our 4th vaccine in the U.S.
Tell us a little bit about Novavax.
I actually I'm a fan of the Novavax technology. I'm actually a fan of all of the technologies. I think that like each of these companies have really like pulled out their A game in this moment. But the technology that we have, the mRNA technology, is basically telling your body to make a particular protein from coronaviruses so that your immune system can learn what that protein is looking like. That same protein is used in the Novavax vaccine, except the Novavax vaccine gives your body the protein. It doesn't tell your body to make it. It just gives your body that protein. And it gives your body that protein in combination with something called an adjuvant, which I just think about it as something that aggravates your immune system. So it shakes up your immune system to like wake up your immune system and then presents that protein saying, hey, now you're awoke. Look at this protein and learn about it. And so those are the two different kinds of technologies. But Novavax's vaccine just showed to be over 90% effective in their phase 3 clinical trial. They're expected to apply to the FDA for the third quarter, which means, July 1 is the start of the third quarter. And they were they were funded under what was formerly known as Operation Warp Speed, which is now just called the Operation. But formerly known as Operation Warp Speed, they were funded under that. So it is likely that it will be the US's 4th vaccine. And so people who have concerns about the messenger mRNA, it's being new, does it alter your DNA? It's like, I'm happy about Novavax because basically I can just be like, you know what, at this point,
We'll just get Novavax.
feel that way, go get Novavax. Like whatever. And one thing that is a little known fact is that actually our work from our team at the National Institutes of Health is incorporated in Novavax's vaccine as well. Johnson & Johnson's, Moderna's, actually even Pfizer's. It's like only one major vaccine that our technology is not incorporated into, and that's AstraZeneca's, but that's not in the US, so it doesn't matter.
All right, you brought up something. Can we do a couple of quick myth-busting questions?
Sure.
Now, people ask these things all the time, but I would rather them hear it from the expert. Does the vaccine change your DNA?
No.
Why? How do I know that? I read somewhere, saw somewhere, some YouTube, Instagram post, something that it does.
I use my head. Oh, God. Let me get my hair together. So I use my head as an example of a cell. So if my round, big old head is a cell inside of your body, one eye is the nucleus, and then the other eye is a compartment called the cytoplasm. So DNA is over here in the nucleus, and where the message from the messenger RNA goes is in the other eye. No matter how I cross my eyes, whatever I do, I can never have one eye. They just do not meet in the middle. It's just impossible. It is impossible. And that is exactly how messenger RNA works inside of your cell. The other thing is that people should remember that your cells read messages all day, right? This is how your body makes hormones. This is how, so we're not telling the cell to do anything that it would normally do. We're actually just very smartly using the machinery in the cell to make a different type of protein. And the message gets chewed up once it's read, and it just stays around for at best 24 hours. So it doesn't hang out in your body and all types of other things. So that's the science behind that.
Okay. Are there microchips in it?
No. But you know where there are microchips?
For iPhones.
Passports, licenses,
iPhones.
everywhere.
iPhones. People be on the internet talking about microchips while the FDA watching them. Like
as they're tweeting from their iPhone, right? As they're tweeting.
Like if you're worried about being watched, then maybe not use your iPhone. I don't know. Like there would be it wouldn't even be financially responsible to put microchips in vaccines. Like it would be so expensive, and you could just do it on phones. If that was anyone's goal, they could just track you via your phone.
I got a question. So we hear a lot about Tuskegee and experimentation and, having some worries about the vaccine related to that. Can you bust that myth a little bit and talk about why that's not something that we should be worried about relative to COVID-19 vaccines?
I mean, when Tuskegee happened, number one, it's extremely unfortunate. But when Tuskegee happened, we were in a completely different time. There were absolutely no Black people at the table. There are actually 2 Black people who get to tell the FDA a vaccine is approved, yes or no. Dr. James Hildreth, the CEO and president, or I think he's president, of Meharry Medical College is one of them, for example. These are like people who are pillars in our community who are deciding these types of things. So people talk about me, okay, like she just popped up out of anywhere. There are Black people at each step of the way throughout this process. When Tuskegee happened, there weren't even Black people on Congress. Like we're just in a completely different time. And the way that medical experiments happen and clinical trials happen as opposed to Tuskegee are completely different. People are given informed consent now. People know exactly what is going in their body. People have the right to refuse. You can literally be in a clinical trial, get all the way to the point where the needle is right beside your arm and say, I do not want this vaccine. And they can't ask you any questions. You just don't get it. There's always the right of refusal in a clinical trial. And it's just so many very stark differences. And as far as, what was happening in Tuskegee was that it was a very pinpointed action against African-American men who had syphilis. In this case, people are like, oh, I don't want to be the guinea pig. Well, good, sis, because there are like 200 million people who've already been vaccinated. So you're not. And most of them are not Black. So you're not the guinea pig. And so I think that there's just very stark differences.
All right, I gotta make sure we get these questions in, and shout out to my cousin.
I'm gonna take Jasmine's question after you.
We're gonna take Jasmine, but it's hardest with family and friends and loved ones sometimes to make that difference. So we really appreciate you really lifting up these messages. Jasmine Hall is just a rising star in public health. She has a great question. She's at Michigan State. She's a Flint native. What advice might you have for youth or young professionals as it relates to staying true to yourself and your values while navigating the challenges of working in public health and academia? And I really want to shout her out. She's leading a movement for millennials and young people in Flint. She has an MPH from Columbia and could have taken that anywhere, but she brought it back to Flint. So she's
love that.
Hours, Jasmine Hall.
I love that. My advice to young people as they navigate the mean streets, really, like people talk about like the hood, like no, academia is the ghetto. Okay. It is like shoot you down, like drive by, like they are not playing, especially with Black people in academia, frankly. Right. But my advice is that you go where you are loved. Period. That I had to realize that in the last year that I don't owe any institution anything. And that in fact, they owe me something. And that I am the prize, and like kind of really remembering that. And it's very hard when you're Black and like you're first generation and all of these things. Like people used to ask me in like the news, what's it like working with Dr. Fauci? When he came to your news show yesterday, did you ask him what it's like working with me? Do not ask me that.
Yeah.
Ask me about my science. And so you have to be very adamant about the fact that you belong at the table that God has given you a place at. And if someone decides that they want to, I don't know, block you from the table or prevent you from speaking at the table, or if people start eating the food that you prepared at the table, you go. You leave.
I love that.
To the table that is welcoming to you. And that is why I'm at Harvard.
I love it. And Jasmine corrected me. My bad. I said Columbia, but she corrected me.
Oh, yay. Hey,
Harvard is her alma mater. And she earlier wanted to make sure that you were welcomed to the Harvard family.
So I want to wear my CAD hat for a second because I want to highlight something that you described, which I think is so important. You have navigated yourself into a space where you have a certain platform and ability. And the way you described how you leverage that for the opportunity to make sure Black conversations and Black people were at the table, whether it was vis-a-vis your commentary, whether it's vis-a-vis your mentorship at Harvard, is really outstanding. And I think it's a great example as I talk to my students who are watching, and we talk to little Black girls. I have a little Black girl who just went to bed who are thinking about doing this work. Use your platform and put someone else on. Use your platform to make sure voices are at the table. So thank you.
The other thing about that is that I know I come from like this place where people like are like, well, yeah, she can say that because like who would deny her, like that kind of thing. It still happens all the time. And actually before this moment, one of the things that I really realized that was very helpful was that I had a mentor who really was so indebted. Not indebted, I wouldn't call it indebted, but he just was such an advocate for me. Like he was an advocate for me, like it was like for himself. And he actually is not just like that for me, but for all of his mentees. And so when you say something, it's like, okay, Kizzy just said that. But when it's echoed by a white man, frankly, it sounds different at some of these tables. And also a lot of times when that man walks into the room, or a woman or whoever, the person of power who is your advocate, walks into the room and pulls out the seat for you, there's really no way that anybody at the table is going to deny you at that point. And so finding your advocate, finding the person, you know what it is, I think now I have the words and how you ask whether or not somebody is willing to advocate for you, because now I've seen his recommendation letter. He said, having Kizzmekia at your institution would be like having me there. So basically, I vouch for her like I vouch for myself. So if you're asking and wondering whether or not someone is your advocate, say, would you vouch for me in the same way that you vouch for yourself? Like really seriously ask them that. But having that person that is willing to break down those glass ceilings or use their power to maneuver the career maze for you is just, it's priceless.
So there's a question from Helen Rayner. She says, how do we know when we can trust being part of or allowing our children to be part of a study?
Well, I wanted to, so I was actually thinking, because I wanted to kind of make a statement around like clinical trials, because at the same time that our vaccine was approved or authorized, Novavax's clinical trial started to enroll. And I was like, instead of getting our vaccine, I'm going to go be in Novavax's clinical trial, because I want to make a point that these clinical trials are safe for people to be in, because of the way that even getting a vaccine to be able to go to clinical trial takes so much data. Obviously the manufacturability of the product, but then also all of the preclinical data. So if there is a clinical trial that says safe to proceed by the Federal Drug Administration in the United States of America, then if you choose to give your time in that way, then by all means, please do.
And then there's a question from Shardy Wagner, who says, he's really asking a question about the correlation between vaccines and ultimately curing diseases.
I don't know what the question is specifically. That sounded like a comment.
It is.
It is a comment.
We do want, it's a comment. And since we want to honor your time and really celebrate you and just say, girl, knock them alive. Yes. I have no doubt when Harvard hired Dr. Corbett, Harvard did a good thing. So this is our last question, because we've gone 2 minutes over, which we typically don't do, but we love you and thank you for being so generous with your time. Absolutely. I think it's the best question to leave us with, which is from Heatherland Uphold. This is great information. She says, what can I, but I'm going to say, what can we do to support your work and your message and the work that you're doing? What's the call to action for us?
Keep people informed. Keep people informed. If you really have the knowledge to be able to really talk to people in your particular community, be that person, be that community advocate in your particular community. Because I mean, obviously I can't make these calls everywhere, right? And so we need people who are trusted pillars in their community to do that type of work on a day in and day out basis. And a lot of times it is a little, I can understand how it's like another job because I've been doing it like for the last year, but it is necessary in this time. And then the second thing is that, you know, it's like, oh, Kizzmekia COVID vaccine inventor. And like, you know, we're doing all these webinars right now. But one thing that I really beg of people is to make sure that the conversation remains open, because we will get to a point where, you know, 70%, 80% of the US is vaccinated, whatever, right? And so, and COVID will be a conversation of the past, but we still have infant vaccines. We still have influenza. We still have all the other diseases that plague various different communities. And so we need people to understand, you know, their health in full. And we need our people particularly to start to be able to understand their health so much that they are standing up for themselves. And so keeping those conversations open is really what I think is great. And then if you are in a position of power, by all means, bring somebody with you.
All right. We're going to send you out with love. These are some of our hometown heroes, Afton Shavers. She's also working on her MPH. She's a force in this community. She says, thank you for putting your Black girl magic on full display. Definitely. Jasmine is coming back. Thank you.
Yes, Kizzy Liddy. I love when people say that, by the way.
For bringing them here. We got so many of these are most of our millennials are a force. They are a force. So they're showing the love. I'm going to let our brother Isaiah close us out. And I will say on behalf of the Michigan State University, on behalf of the
Flint campus,
the Flint campus, and all of that, we honor you. We salute you. We join you in the fight. And just thank you.
Thank you.
Yeah. One of my mentors would always say, leadership is the art of disappointing people at a rate they can absorb. Sometimes you just gotta blow shit up. I'm just thanking you today for blowing shit up. We love you, we appreciate you, and we look forward to continuing to support your work.
All right, thank you guys. Have a good night.
You too.
Bye.
Damn, we didn't even get her for the after show. Damn.
Are we still live?
No, I ended the broadcast.
That's cool.
I believe I did end the broadcast. Let's make sure. Yes,